The Premier's question is now 11:19. And Premier, I'm going to call on the opposition leader to put his first question to you. Mr. Opposition Leader?
Yes, thank you very much, Mr. Speaker, and good morning to Bermuda and colleagues within Parliament. Premier, my first question to you, considering now that we are beginning to ease regulations on businesses so that they can start reopening construction and the likes, and taking into consideration many employees may be a bit concerned as they return to work, whether conditions are going to be favorable to them and protecting them. Are you looking at any measures of monitoring establishments' compliance to the guidelines that we've set out to ensure that as they reopen, these guidelines are being stuck to, they are being adhered to?
Thank you. Premier, would you like to respond?
Yes, absolutely. Thank you very much, Mr. Speaker. In response to the opposition leader, certainly regarding the monitoring of these particular establishments is particularly important. The continuing precautions regulations which enforce allow the Minister of Health to actually close down a business that is not in compliance with any of the guidance which has been issued and posted on the particular website, coronavirus.gov.bm, in combination with the Ministry of Health's officials who regularly do inspections, such as the Department of Environmental Health. In addition, supported by the Ministry of National Security, managed by the Disaster Risk Reduction Mitigation Team, under the leadership of the Minister of National Security. Those, whether they be regiment officers and or police officers, are actually assisting in making sure that the enforcement is being monitored. It is particularly important, as the opposition leader said, that persons heed to this advice, and the easiest and most effective way of this happening is ensuring that every single person in every single establishment where there is working taking place is wearing masks. This has been reiterated by the Minister of Health, and I know that the team from the Ministry of National Security who's assisting in monitoring these particular things, monitoring compliance, is making sure that this is enforced. Additionally, the Ministry of National Security has looked to bring in additional persons to support. I do know that traffic wardens in the city, the Corporation of Hamilton, are also assisting with some of the enforcement measures as well. And I do know that there was a move to get bailiffs to assist in the enforcement measures as well, just to make sure that we are continuing to monitor the establishments which are being put in place. But I would urge businesses to note that if they are caught not following the regulations, they will be closed down, and the government will do that under the abundance of caution to ensure that people are being safe.
Thank you, Premier. Mr. Opposition Leader, would you like to put it to supplementary or yes, another question?
No, supplementary.
Go ahead.
Yes, Premier, taking that into consideration, is there any one particular area, if there are concerns, that you can advise the public that they can call or email to that will speed up the response to ensuring that companies and establishments are compliant? So is there any one particular area, if there is a concern, that they can contact, as opposed to many times what happens is they may contact one of us as MPs or the likes, but is there any one particular area you can identify if they have any concerns that they can contact you or the government?
Premier?
I did one of those mute mistakes. My apologies. I was talking and I was on mute. Thank you, Mr. Speaker. My apologies. I thank the opposition leader for his question. I believe there are two particular ways in which persons can report such violations. And the instances where those can be reported are with Bermuda Police Services. They are primarily responsible for type of enforcements, and they will share that particular information with the teams of whom they're working with, as the EMO operational meetings have persons from not only the Ministry of Health, but also Ministry of National Security, the police, and the regiment. But the members of the public, if there are breaches, are encouraged to call Bermuda Police on 211. They can also go to Bermuda Police website. And just so I can confirm that, I believe that website is, I want to get the wrong one because I know there is a fake Bermuda Police website, but they can go to the Bermuda Police website, which can be found at police.bermuda.gov.bm. and then they can go ahead and to report any types of businesses there. There's a form which they can fill out to report items there.
Thank you, Premier. Assistant Leader, would you like to do another supplementary or new question?
Yes, another supplementary.
Continue.
Thank you, Mr. Speaker, and thank you, Premier. Considering we've already seen played out in the public one particular establishment complaining about a minister walking into their establishment, is there any advice that you can give to businesses out there as to what they can expect from those who are monitoring, like the Ministry of National Security or the regiment? Is there any protocols that you can give to the establishments out there that they can expect from these officials who might be monitoring as a process that they can expect when they come into an establishment, just to check on things?
I thank the opposition leader for his question. I thank the opposition leader for his question, Mr. Speaker. In most instances, when there are persons who will be uniformed, whether they police or they'll be from the Department of Health, they will have their particular identification, which will be necessary and required, so that persons will know whom they are in that particular case and instance. I think restaurant persons would be familiar with officials from the Department of Environmental Health. Clearly, police and regiment persons are typically uniformed. I believe the case which the opposition leader was referring to was a case in which the Minister of National Security, I would say, on a Sunday went to go look and inspect something for himself. And I am pleased and happy that I have that the country, I think, should be happy that we have a dedicated team of ministers who will go ahead and try to make sure that they are dealing with matters efficiently to protect the safety of the public. So to answer the opposition leader's questions, almost every single enforcement officer I would expect, certainly from health, police, and or the regiment, whether they be bailiffs and or wardens in the city of Hamilton, will be uniformed and should be easily identified.
Thank you, Premier. Officer Leader, would you like to move on to your third supplementary or new question? No, sorry, new question. You only get two supplementaries. I'm sorry.
Yeah, I almost got away with that one, Speaker. Okay. Yes, second question. Yeah, next question. Premier, taking into consideration, we now have testing done at Southside. There have been reports that they are being told that they would be notified of their results by their doctor. We've also heard from doctors' offices that tests have been done, but they have not been notified, and 4 days have gone by plus, and the doctor's office has not been notified. Is there a particular time frame that those of the public who are getting tested, is there a particular time frame that they can be given that will guide them into an expectation of when those results would be given back to them?
Absolutely. I thank the Honorable Officer Leader for his question. I do know that the Southside Lab turns around most test results within 24 hours. I do know that they have further developed an automated system in order to make sure they relay those particular answers not only to the doctors, but I believe the Ministry of Health is working on a further revision to actually be able to report negative results directly to patients given the volume of persons that are there. It's important to note that this process itself is self-reporting. So unlike in the other instance, of labs, where individuals would have been referred to their doctor through the regular testing phase, this is persons who self-refer themselves. There's instances where doctors' contact information may or may not be correct. Information may be relayed. And what my advice to the opposition leader would be, if there's any doctors that are contacting him for those particular questions or challenges, that they direct their information to the Ministry of Health. The Southside Lab does report all information to the Ministry of Health. The Ministry of Health is not the responsible party to relay that information to individuals. The doctors are. But given the fact that we've gone from a process where we're testing about 20 to 30 people a day, which are referred to doctors, to a process where we're testing multiple hundred persons a day, there was definitely a need to the change of process, and the need to the change of process, which I think was agreed, to the best of my recollection, was agreed last week, is a system would be set up whereby negative results could be reported directly to patients and positive results can be reported through their physician.
Supplementary.
Thank you, Premier. Would you like to do your supplementary?
Yes, thank you, Mr. Speaker. Appreciate that. Thank you, Premier. Taking that into consideration, being aware now that there has been some form of a gap in between understanding exactly how the results will be given to those who have been tested at Southside, would you take it upon yourself to ensure that the public is aware? Because there still seems to be some confusion as to whether or not they're supposed to get it from their doctor then, based on what you have said.
Mr. Speaker, I think that the Minister of Health has reiterated that, but I have no issue reiterating those particular things in public. What I would say is that I do not accept the opposition leader's premise overall that there is a particular gap. What I will say is that this is a challenge, and part of the challenge is that between the fact that people were, in one instance, being referred by doctors, so when they were referred by doctors to the testing which was taking place, administered by the Ministry of Health, the doctors are going to necessarily expect their results. In other cases and instances, when people are self-referring, these are people who may not have doctors, their doctors may change, and they listed old doctors. There's lots of different things that are there. So I don't particularly, as I said, accept the word gap. There are certainly, when we've changed this particular process, there are certainly things that that could have been done better, but I don't think it's a question of the gap. All these results are being reported to the Ministry of Health as required under law. The results are also being sent to the doctors whose contact information were given. There are particular instances and individual stances where people, as I said, either do not have regular doctors, though attend their doctors may change, or the contact information would be incorrect. But I am reasonably assured, and I will ask the Minister of Health to reiterate that information out to the doctors' communities, because I do not believe that right now we're experiencing that many problems with that. But I'm happy to take the question of which the opposition leader said under advice. I know the Minister of Health is listening, and I'm certain that we'll be able to send out further guidance to the doctors, and also making sure that the Shadow Minister of Health is inside of that communication so she can be aware of what's going on.
Thank you, Premier. Officer Dean, would you like to put your second supplementary?
Yes, second supplementary. Thank you. Thank you. Thank you, Premier. If someone is, you mentioned about being tested negative, Premier. If someone is tested positive, can you tell us and the public what one can expect from that to follow from government's involvement? What should that person expect as the next procedures, so people are aware of what they can expect if in the fact that they are positive?
Thank you for that question. I'm going to do my best to answer, as these things typically fall under the ministry of the purview of the Minister of Health, but for the most part, I'm relatively familiar with the process. If that happens, and if there is a positive case, the positive case is reported to the Epidemiology and Surveillance Unit, as it is a reportable act under law. The Epidemiology and Surveillance Unit does not inform the patient. The patient is informed by their primary care physician. So once they're informed by their primary care physician, they will then be contacted by an officer from the Epidemiology and Surveillance Unit to advise to give public health advice. The public health advice, I'm sure, would consist of a number of issues. Number one, certainly the requirement for them to be isolated from other persons, and making sure that they are able to effectively isolate wherever they are. If they're not able to effectively isolate wherever they are, there may be assistance which may be offered for particular isolation to ensure that there's no spread. If they live alone, then they'll be asked their contacts, I assume, at work and also in the community. If they do not live alone, then the contacts inside of their household will likely be assessed by the Ministry of Health team at the Epidemiology and Surveillance Unit, and will likely be sent for testing on whatever the epidemiology and surveillance unit deems to be the correct procedure. I would say, Mr. Speaker, that as confidential as this particular process is, I actually don't have a view into it. And I thought it was an interesting conversation that the Minister of Health and I were having the other day, where there was comments, and we actually do not know the names and identities of these persons who are positive. And I think that that is keeping with the level of confidentiality which is actually ascribed to this particular process. So I think the epidemiology and surveillance unit does an excellent job of making sure that these things are kept confidential, and they follow the public health guidelines insofar as making sure the person is isolated, their contacts are, they do the contact tracing, their contacts are tested and quarantined. Any contacts certainly would be required to be quarantined, and then follow-up testing would certainly take place.
Thank you, Premier. Opposition Leader, that's the your last supplementary on your second question. Would you like to move to a third question?
Third question. Yes, thank you, Mr. Speaker, and thank you to the Premier in our effort to work together. It was important to get clarity on some things for the public, so I appreciate the answers thus far. My third question, Mr. Speaker, has to do with procurement. Can the Premier explain, taking into consideration, they have, I'm sure, been bombarded, and we've been a part of that process and bombarding the government with opportunities to acquire PPE. We've seen how played out where, you know, 1 minute we're getting PPE, and next minute we're not sure when it's actually coming, or we know that private sector has brought in PPE already, and there have been complications with customs concerning that. Can the Premier explain what really is the procurement process that the government is going through to secure PPE? And I ask that question so that people understand that that the government has a fair and equitable process in place.
Thank you for the question. The PPE and procurement is being led under the Public Health Emergency Response team and their Incident Command Center, which has been set up for COVID-19. And so as far as the procurement and how the procurement is actually happening, is that is being led by Anthony Hunter of BHB and Mr. Dean Paris, who also works at BHB, but who has been seconded over to the Incident Command Center. What I would say is that inside of that particular process, they are making sure that we're placing orders not only for the community, but also for the government. They were talking about nursing homes, the hospital, what is needed for emergency services and other services, et cetera. Our main issue has not necessarily been the procurement of PPE, to be honest, Mr. Speaker. Our main issue has been getting it here. And I think that's been the biggest challenge. So what we've recognized early is that we not only want to use the resources of the government, but we also want to help and use the resource of the private sector. So there are a number of persons who wanted to support this particular process. I'd also reached out to the Leader of the Opposition for names. Those names were supplied to that team, and that team actually bounces some of the ideas, suggestions, and challenges that they have when it comes to procurement with that particular team of private sector persons to assist. Regarding the fairness of that, what I have now done, and the Minister of Finance, I would say more, now that we're out of the emergency phase, a lot of these things are now going through regular procurement. So we've gone from the position of emergency, we need to get these things as quickly as possible. Now we've gone to the position of we have adequate stocks and supplies. We are now looking at restocking for future months and making sure that we are going to then go ahead to put out the various quotes which are necessary and required in order that persons can go ahead and participate in that particular process going forward. I think the process overall right now has been fair, but by and large, most of it has been procured directly from suppliers inside of the People's Republic of China and overseas in massive quantities of bulk. So when we're talking about 400,000 surgical masks, 500,000 N95 masks, masses of face shields, these are very, very, very large quantities which have been done. As we move forward to the resupply, we're going to make sure that we do it under a better framework of, I would say, the procurement process to ensure that the government is getting value for money.
Thank you, Premier. Opposition Leader, would you like to put us up your first supplementary?
Yes, first supplementary. Thank you. Thank you, Mr. Speaker. For clarity then, is there a difference between, because you mentioned the hospital, now obviously the hospital is seeking out PPE and government is seeking PPE as well, I'm sure, to ensure that it's essential services, customs and police and the likes and fire. So you're saying that the team that is at the hospital is also handling the procurement for government as well and its needs. Is that what you're saying?
The teams work together. The Bermuda Hospitals Board clearly has sources and trusted sources which they've used for over the years. And so it's not that BHB is buying something and the government's buying something. They're all basically together. We deal with the accounting issue later about what belongs to BHB and what belongs to the government afterwards. But so far as procurement, we're not doing a separate buying for the hospital, and we're not doing a separate buying for government and government services. They're all part of one order to get the best possible price for these very bulk orders. And it's difficult ordering in small quantities, so it wouldn't make sense. So as I say, when we're talking about these very large things, we're talking about hundreds of thousands of masks that are coming in at once. And we've been able to get these things and using a lot of suppliers and also local logistics companies. One thing that the Minister of Health has also informed me is that in addition to buying these things from overseas, we have also done local procurement for smaller issues where there's thoughts from the local companies who may have masks and other things which may be in stock here locally.
Mr. would you like to put your second supplementary?
Yes, thank you, Mrs. Speaker, and thank you, Premier. Now that we are testing at a higher level, I'm making the assumption that we are looking long term, because we know that the future and today is setting out a new norm on how we walk about publicly, how our establishments, private and public sector, met out their businesses. With all that in mind, are we then forecasting what we're going to need for the future? I think part of that question also is, and I just wanted to ensure that there was a member that I put forward, and that member has not been called at all to be on that team.
I just want to clarify the question I'm answering.
Yeah, forecasting. I was trying to understand about the forecasting. So obviously there's a new norm for Bermuda, and we're trying to satisfy the immediate need of increased testing for PPE. How are we looking at the future, and is the team establishing a protocol and volumes that we will need in the future, knowing that it's highly likely that we're going to see more and more of this type of incidents happen?
Oh, absolutely. Thank you, Mr. Speaker. I mean, that's a great question, Leader of the Opposition. And from the perspective of where we are right now, it was getting the stuff that we needed right now. Now we have many months of supplies, and now it's a question of planning for more. And so, especially when it comes to the private sector, persons being open, the actual PPE, which is taken by testing. So because we've ramped up our testing regime, it actually means that a lot more PPE is being used than was being used before, because PPE are gloves, PPE is by all of those, PPE includes all of those particular aspects. So there is more that is being consumed. Those things are being planned out, so we can then go ahead and procure more, so we have it. Regarding testing, which the opposition leader touched on, the government has sent communication both to the Bermuda Employers Council and to the Chamber of Commerce, reminding them that they can reach out to their employers and member companies to go ahead and book testing to make sure that persons will be tested. And I think that we have enough testing supplies on island right now currently to do 55,000 tests. So there's a significant amount of testing supplies which are on island. We are not short on testing supplies in any way, shape, or form. And so we're going to continue to, as I said, go through this process. And I believe that the testing protocols are being finalized by the Chief Medical Officer, and I'm hoping that we can release those to the public, our entire testing strategy, either next Monday or next Wednesday at the government's press conference.
Thank you, Premier. Opposition Leader, that brings you to the end of your questions. The next member who has a question for you, Premier, is the member from St. George's, Honorable Member Swan. Would you like to put your question?
Yes, thank you. Good morning, Mr. Speaker. Question for the Honorable Premier regarding emergency assistance. Premier, what changes have been made to the initial criteria to enable more struggling Bermudians to benefit from the emergency employment insurance safety net?
I thank the honorable member for his question. Certainly, this is a project that we wanted, that was important, and as the Minister of Finance indicated in his particular statement, was important that we got up, and it was emergency. So at the very first instance, it was dealt with those persons who were left unemployed. And as a result of the government's changes, what was realized, of course, with the extent of the closure, that there were more persons that found themselves in hard times who may have been small business, who may have been in the informal economy, who may not have been registered with the Office of Tax Commissioner. And in order to be eligible for this assistance, you had to either prove that you worked for an employer that was registered with the Office of Tax Commissioner, or if you were self-employed, had registered with the Office of Tax Commissioner. The fact is that there were some persons in the informal economy who were not. So they may have been hustling, they may have been doing things on their own, they may have been things like personal trainers, working in gyms and those type of issues, and they did not have access to any form of assistance. What we felt is that this would have been a good opportunity to, number one, get persons compliant and registered with the Office of Tax Commissioner, while also being able to provide them some form of benefit. It is important to note that the government benefit did not require that for small businesses that they had to have no debt with the Office of Tax Commissioner, but they needed to be in good standing. That means on a payment plan, et cetera. So now these persons who have registered with the Office of Tax Commissioner, who may have been on inside of the informal economy, have now been told to register. Once they register the Office of Tax Commissioner, regularize their details so they can pay payroll tax going forward, they are eligible for a benefit of $300 per week. Additionally, there were some changes that were made in being flexible with certain employers. So there were some larger hotel employers who may have wanted to keep some of their employees on staff or keep paying some of their benefits, but work with the government and not lay them off entirely. So for instance, if an employer wanted to pay a certain portion of a person's salary and give the other part to the government to pay, the government would have saved money overall versus if that employer would have just laid the persons off. The government may have been paying $1 million. In this particular case, the government may just pay $500,000 while working. So there were adjustments that were made, and part of the regulations and amendments that were tabled by the Minister of Finance speak to those modifications and changes, which are important to make sure we're flexible in getting the relief to those persons who need it.
Thank you, Premier. Would you like to do a supplementary?
That was a very comprehensive answer, Mr. Speaker, and covered my supplementary.
Okay. The next member has a question for you is the Honorable Member Phil Simons. Honorable Member, would you like to put your question to the Premier? Member Simons? Honorable Member? I'll move on to the next person. The next member on the list is MP Lister. MP, would you like to put your question? I'm moving on. The next name on the list would be that of MP Smith. MP Ben Smith, would you like to put your question?
Yes, good morning, Mr. Speaker. Good morning, colleagues.
Go right ahead and put your question.
Mr. Speaker, as it has been confirmed that a member of the Bermuda Fire Service has tested positive for COVID-19, that member and their family was quarantined and the stations that they worked at was sanitized. Can the Honorable Premier please tell this Honorable House what the protocols are for testing, tracing, and quarantine in light of this positive test?
Thank you. Premier?
Mr. Speaker, I am not sure of the exact protocols of which are followed. I'm happy to make sure that that issue is reverted back to the Shadow Minister of National Security by the Minister of National Security and Ministry of Health. I think I gave a broad overview in an earlier question for the opposition leader, so I don't want to try to take up too much time trying to guess the answer. I would say that there are public health protocols which were followed. It's the things that were identified. The stations were clean. Persons who were in close contact may have been quarantined, and their family, the family may have been isolated, and anyone who's tested after that will be isolated, but those persons will be on quarantine. The persons who were not positive would still be on quarantine. So I think that's the best answer I can give, but I'm happy to ask the Minister of Health and the Minister of National Security to revert back to the honorable member with that.